Bom, ótimo, muito obrigado. Eu vou agora fazer uma coisa que inclusive tinha esquecido, que é a nossa... deixa eu interromper aqui só um pouco. Não está aparecendo aqui para mim. Só um pouquinho.
So, Augusto, sometimes the internet connection is unstable. So, if that happens, I may log in again.
Okay, you can do that while I'm fixing something also. Just a minute, let me try to...
So I think now we should start. We are on.
Let me just start with the presentation in YouTube, and we can do that. Just a minute, because I want to do the presentation also at YouTube.
Okay.
And I want to introduce yourself properly.
Okay.
Taking some time. It seems that's already live at YouTube. Well, good evening, everybody. I would like to introduce Dr. Tanuj Dada. He's a professor of ophthalmology at All India Institute of Medical Science, New Delhi, India. Professor Dada has more than 5 textbooks on glaucoma, and more than 250 research publications in peer review journals, and more than 75 chapters. And he was innovating new techniques of cataract and glaucoma surgery. And he's currently the Secretary General of the International Society of Glaucoma Surgery, Chair of the Association Advisory Board of the Global Education Committee of the World Glaucoma Association, serve as the Board of Directors of the Asian and Pacific Glaucoma Society, and as expert of the Glaucoma Task Force of the International Council of Ophthalmology. And he's the chief editor of the Journal of Current Glaucoma Practice. I would like to thank you very much, Professor Dada, to be with us today, and telling everybody that it's really early in the morning in India. It's 5 in the morning in India, and it was my mistake. I thought it was not that bad. So sorry again about it. Hope you do not sleep during your lecture. If you do that, you just while at you.
Yeah.
So do not do your meditation now. It's a really pleasure to have you here. We are proud to have you here, and we're anxious to have you giving your lecture for our society. You can share your screen now and start your presentation. Thank you very much.
So, can you see my screen now?
Yeah, I can see your screen.
Okay. So, good evening, everyone from Brazil and other parts of South America. So, namaste from India, and I hope and pray that all of you are safe and sound in this ongoing COVID-19 epidemic. So today's talk is on a topic of meditation and glaucoma. And I have no conflict of interest disclosure, but for those of you who are really interested to know about this subject, I would like to recommend 2 books for you. The first one is by Paul Brunton. He was a European explorer who came to India and investigated for nearly 20 years the business of yoga and meditation. And he has written a very classical text on this, the quest of the over self. So this is for everybody on what is meditation and what is the benefit for you. And the second book is for the research scientists, and that is on the science of meditation, how to change your brain, mind, and body with meditation, with Daniel Coleman. So these are 2 books I recommend for you to have an understanding of what is meditation, how it works, and what is the benefit for you as well as your patients. Now, I remember it was 5 to 6 years ago when I presented the first research protocol at my university that I'll be investigating meditation for primary open angle glaucoma. And universally, everybody's thought that I am going to end my career with this absurd idea. And people thought it's a really very crazy idea. And I was actually a bit depressed at why people are so much against this. And I found some solace in what Einstein said, that if at first the idea is not absurd, then there is no hope for it. So I carried on this pursuit of the research on meditation and glaucoma, and you see what can be the impact for glaucoma patients. Now, if you see the term yoga, it's a broad term. It basically means union of the mind, body, and spirit. This was standardized in the 3rd century BC by a famous Indian saint who's known as Maharishi Patanjali. And this was a science to cultivate holistic health and obtain a higher state of consciousness. Now, let me tell you that yoga involves basically three components. One is physical postures and exercises. The second component is breath awareness and breathing exercise. But the main component is basically meditation. So for glaucoma patients, we are not at all concerned with the physical postures and exercises, because if glaucoma patient do various physical postures, it has been shown in some studies, especially with the inverted posture, you can actually raise the IOP. So our concern for glaucoma patients is only focused on breath awareness and meditation, not any physical exercises. Now, meditation is classified into two broad categories. One is called focused attention. So you are training your mind to focus on the breaths or a mantra or a sound. What we have been using is the breath because this is the simplest method and also has additional benefits, as I explain later. The other kind of meditation is known as open monitoring, where you just observe your thoughts. The basic purpose of meditation is to induce relaxation and regulate attention. This leads to a state of calm and mental equanimity. Now, in terms of modern physiology, meditation leads to what is known as the relaxation response. This was a term coined by Herbert Benson. So this is a coordinated physiological response driven by the parasympathetic nervous system. It's a mind-body state to counter the stress response. And that is how actually meditation works, impacting both the activity in the brain and various parts of the human body. Now, the first concept that I want you to understand is the relationship between stress, cortisol, and intraocular pressure. Now, whenever a patient with high intraocular pressure comes into your outpatient clinic, you ask them one leading question. Did you take any form of steroids? It may be oral, inhalational, skin creams, or nasal inhalers. Because steroids can lead to a rise in intraocular pressure. So this is a question that we ask all our glaucoma patients. But perhaps we should also be asking the patient about any recent psychosocial or emotional stressor. Because if the patient has increased levels of psychological stress, that leads to increase in endogenous cortisol, which can lead to an increase in intraocular pressure. So in addition to asking about exogenous steroids, we must factor in endogenous steroids and ask for any event leading to stress or any background leading to chronic stress. This becomes especially important in glaucoma patients because they have an abnormality in the steroid receptor in the trabecular meshwork. And glaucoma patients are therefore high steroid responders. So if glaucoma patients get increase in endogenous cortisol, they are going to respond by spike in the intraocular pressure. And it has already been shown that patients of glaucoma and ocular hypertension have increased levels of plasma cortisol, and there is a positive correlation between the levels of endogenous cortisol and the intraocular pressure. The other important concept to understand is that glaucoma is no longer just an ocular disease. Glaucoma is now classified as a neurodegeneration, And you have a lot of factors which lead to the retinal ganglion cell apoptosis. Primarily, you have the barotrauma, but you have a number of factors implicated, such as ischemia, hypoxia, oxidative injury and mitochondrial dysfunction, glutamate excitotoxicity, decrease in neurotrophins from the brain, especially BDNF, inflammation of the glial cells induced by tumor necrosis factor, and a dysfunction in nitric oxide. So although we keep on discussing all these factors, we only treat the intraocular pressure as of date. And this is becoming important because recently it has been found that glaucoma patients have a transsynaptic neurodegeneration affecting both the lateral geniculate nucleus and the occipital cortex. So it's not just a damage to the optic nerve, you are having a damage documented in the central nervous system, and therefore the brain becomes a potential diagnostic and therapeutic target for glaucoma. It's important for you to understand that what is the relationship between stress and neurodegenerative disease. Now, once you have stress, you have release of the corticotropin releasing hormone, which leads to release of the ACTH, and then you have release of the cortisol from the adrenal glands. And this is directly initiated by the stress center in the brain, that is basically the amygdala, which is dealing with the emotional response. And what happens when you have increase in endogenous cortisol? This leads to a direct damage to the neurons of the hippocampus. And this is responsible for loss of memory and cognitive decline and neurodegeneration. So remember, if you have increased stress, you have increased level of endogenous cortisol, and that goes and damages the hippocampal neurons. So there is a direct relationship between stress and the neurodegeneration. And this may be one of the factors why we keep on saying that glaucoma patients have poor compliance or adherence, or they forget taking their medicines. This may be related to the increased levels of cortisol destroying the hippocampal neurons. Now, these are some famous studies on aging, which are called the MacArthur studies of successful aging, where they showed that the cognitive decline was directly associated with increase in cortisol, and that is because of the detrimental effects of the glucocorticoids on the hippocampal neurons. But the good news was that this was reversible if you could lower the levels of endogenous cortisol. Now, how does glaucoma impact quality of life? So this is an important thing because we keep on discussing quality of life, but we are not doing anything to improve the quality of life of glaucoma patients. So glaucoma patients have increased levels of anxiety, depression, and they have an impaired executive function. So nearly 22% of patients in this study were found to have dementia. And this has direct implications on the adherence, and they have a poor quality of life. This is a study from Singapore in which they found that glaucoma patients have a very poor psychosocial function. They have a greater anxiety, lower self-image, less psychological well-being. And another important thing was they have reduced confidence in the healthcare system. So you can see very high levels of anxiety in glaucoma patients. And what we found was, in our study done at our center, that already glaucoma patients have a poor quality of life. But when you initiate medical therapy, actually the quality of life worsens because of the drug-induced side effects, and many patients he just stopped taking therapy because of the side effects. So glaucoma patients have a poor quality of life, and actually your therapy may worsen the quality of life. Now coming to the third concept, what is the impact of meditation on the brain? You have understood that now glaucoma is also classified as a neurodegeneration. So if you summarize all the current studies on meditation, one thing that comes out that meditation can reverse or arrest neurocognitive decline, and there is now ample evidence to suggest that there is neurogenesis occurring in the adult brain in patients or in long-term meditators. So there is an age-defying effect of meditation on the gray matter atrophy in the brain. This is the first study published from the Harvard Medical School by Sarah Lazar, in which they reported that meditation experience is associated with the increased cortical thickness. And actually, you can see this is the effect of meditation. You can see the cortical thickness. This is the patients who are meditating. They are maintaining a static cortical thickness. And this is the normal decline which is occurring with age. And this was also applicable in the occipital cortex. So this is the first study that actually showed that meditation offsets age-related cortical thinning. However, this was a cross-sectional study. So this is a meta-analysis of 21 neuroimaging studies on meditation, where using the MRI, they found that there is definite evidence of increase in the gray matter thickness of the brain in several areas by MRI imaging. And this was the mechanisms attributed were neurogenesis, increase in angiogenesis, axon sprouting, gliogenesis, and synaptogenesis. So MRI evidence of altered brain structure with increase in gray matter thickness in several parts of the brain, including the anterior cingulate cortex, the frontal cortex, as well as the hippocampus, which we were discussing, responsible for loss of memory. Now, this is a very interesting longitudinal study done from the same group from Harvard Medical School by Sarah Lazar, in which they studied the short-term impact. So this is an 8-week study on meditation in previously patients who have no experience. So this is naive patients. And what they found, just with 8 weeks of meditation, there was increase in gray matter concentration in the hippocampus, the posterior cingulate cortex, and the temporoparietal junction, as well as cerebellum. So this is evidence for the longitudinal increase in gray matter thickness with meditation, in addition to the previous cross-sectional study that I showed you. Now, what about changes in the white matter of the brain with meditation? Again, effect of meditation has been shown to increase white matter density in patients who are meditating as compared to the controls, and there is no age-related decline in the white matter degeneration as compared to the healthy controls. And by MRI studies, it has been shown that the increase in white matter density corresponds to increase in myelination, increase axon density, as well as axon membrane integrity, diameter, and fiber geometry. So this is advanced studies on MRI imaging showing increase in both white matter as well as gray matter. And to summarize, how you calculate the age of the brain. So this is a machine learning algorithm which correlates the MRI with and calculates a brain age index. And to summarize, what they found was that the age of meditators was 7.5 years younger than controls. So there is very robust evidence that meditation is beneficial for brain preservation. It definitely protects against age-related atrophy. And we keep on talking about drugs for neuroprotection. So this is clear-cut evidence that meditation can confer neuroprotection to the brain and prevent the age-related degeneration of the brain. What about the impact of meditation on cerebral blood flow? So now this is very well documented by various studies, especially from Alan Harris, that patients of glaucoma have both decrease in ocular blood flow as well as they have a decrease in the cerebral blood flow. And in fact, the small vessel disease may be a biomarker for a primary open angle glaucoma. And there is also evidence of reduced cerebral blood flow in the visual cortex, which is directly correlated with the visual field damage, the Curtis ratio, ganglion cell thickness. So evidence of decreased cerebral blood flow, especially in the visual cortex and as well as the ocular blood flow. But the question is, can we do anything about it? So you have all these studies documenting a decreased blood flow to the central nervous system and the eye. And you have this study showing the impact of meditation using the single photon emission computed tomography known as the SPECT scan. And what was reported is that with meditation for 30 minutes for 5 days, you have an increase in the cerebral blood flow with imaging. You can see pre and post imaging. There is a definite increase in blood flow to the central nervous system. And this is a very important impact of meditation on the human brain, which may be the main factor why it is leading to a neurogenesis even in the adult brain. We did this study at our university. This is a machine which is known as functional near infrared spectroscopy. So it picks up the oxygenation in the human brain. So what we found was that with a 6 weeks course of meditation, there was a significant increase in oxygenation of the brain with the fNRS scanning. And what we found was that there was an upregulation of the brain-derived neurotrophic factors in these patients. So this is an important finding that with meditation, you are increasing cerebral blood flow and you are also enhancing the brain oxygenation. And this is a recent machine which was acquired by our Department of Psychiatry, where we could also measure the oxygenation of the occipital cortex. And you can see the effect of 6 weeks of meditation. There was definite increase in oxygenation of the occipital cortex after a 6 weeks course of intervention. And this is in patients of primary open angle glaucoma. Now, what about biochemical changes induced in the brain? There is a lot of talk about the glutamate toxicity related to glaucoma. I'm not going in detail of the pathogenesis, but this is a technique which is known as magnetic resonance spectroscopy. So you can pick up the biochemical changes in the human brain. And what they found was that there was a reduction in the cerebral glutamate levels in brain in patients who were meditating. And there was a negative correlation between the glutamate levels and the years of meditation. So you can reduce the cerebral glutamate with meditation. And because you are increasing the oxygenation of the human brain, and you know that oxidative stress and mitochondrial dysfunction lies at the center stage of glaucomatic neurodegeneration at the cellular level. So what is the impact of meditation on oxidative stress and mitochondrial dysfunction? So you can see this study done in 26 healthy controls with 20-minute meditation published PLOS ONE. that with meditation, there is an upregulation of the mitochondrial ATP synthesis. So meditation promotes mitochondrial energy production, and you have downregulation of the NF-kappa B. This is the main inflammatory hub. So with meditation, you can actually upregulate mitochondrial function, and that is the important thing at the cellular level for glaucoma patient. Now coming to patients of normal pressure glaucoma who get the disease without any barotrauma, and that is primarily due to a autonomic dysfunction or a decrease in the blood flow to the optic nerve head and the central nervous system. Now, glaucoma has been described as a sick eye in a sick body. And what has been shown is that glaucoma patients have increase in sympathetic nervous system activity and a decrease in the parasympathetic nervous system activity. And therefore, this leads to a lot of factors, including arterial hypertension, and it can also impact the effectiveness of the autonomic agents we are giving to patients. So this is very important thing which can benefit from alternative therapies. And how you measure the autonomic nervous system, whether it is healthy or no, you would do a test known as heart rate variability. So better the heart rate variability, better is the autonomic function. This is a study measuring the heart rate variability in patients of normal tension glaucoma versus healthy controls with a cold provocative test. And what they found was that normal tension glaucoma patients have a disturbance in the autonomic nervous system with a predominance of sympathetic activity, which further increases on stress provocation. Now, this leads to a state of vasoconstriction and endothelial dysfunction, and this decreases the ischemia threshold across all the organs of the body, including the eye. So this is a very important concept to understand why patients of normal tension glaucoma continue to progress despite whatever therapy you're giving them, because it's a problem in their autonomic nervous system with a sympathetic overdrive. And you can see in this study from South Korea, the visual field was directly related to the autonomic nervous system. So higher the dysfunction, more the sympathetic predominance, faster was the visual field progression. So this has clinical implications. If you have autonomic dysfunction, the patient may have a faster visual field progression. So the important question again is, can you do anything about it? So this is the new frontier of science, brain over body, the willful regulation of autonomic function. And you can see this study conducted showing the impact of meditation for 20 minutes versus controls on using the EEG and the heart rate variability. What they found was a short-term intervention with meditation leads to a decrease in the sympathetic activity and an increase in the parasympathetic activity due to a better regulation of the autonomic nervous system by the frontal cortex. So this is very important. With meditation, you can regulate the functioning of the autonomic nervous system by a better control of the frontal cortex. Now, what about associated systemic disease? So many of our glaucoma patients walk in, they have glaucoma and they have many other diseases, especially related to lifestyle. So this was a study we did in our patients, and we found that out of the patients of glaucoma, nearly half the patient had associated systemic hypertension, and 1/3 had diabetes, and 16% had both. And I just about systemic hypertension, you all know that chronic stress leads to systemic hypertension. But what I'm trying to emphasize is that chronic stress can also lead to ocular hypertension. So what is the impact of meditation on the chronic diseases? So this is the scientific statement from the American Heart Association, which reports that meditation can be considered a reasonable adjunct to guideline directed therapy for cardiovascular risk reduction. So it is already being taken in as an adjunctive therapy for cardiovascular risk reduction by the American Heart Association. And this was a very important article published in Circulation. What they found was that stress reduction with meditation intervention, there was a 48% risk reduction in mortality related to a reduction in blood pressure and psychosocial stress. So this is a very important thing to convey to your patient if they have glaucoma and other diseases, that with meditation you can impact especially cardiovascular disease and reduce the risk of mortality. Of course, many other benefits of meditation. It can help patient reduce smoking, can help in metabolic syndrome, patient with chronic kidney disease. And now there is a plethora of published literature that meditation is beneficial for a lot of psychiatric disorders and physical disorders such as pain, arthritis, psoriasis, multiple sclerosis, and HIV, and also to decrease stress in otherwise healthy patients. And one thing which we ignore for glaucoma patients is the caregiver burden. So caregiver is a person in the family providing care to the elderly glaucoma patient or to the small child. And this was one of the first studies that we published, the caregiver burden in the mothers of the children with primary congenital glaucoma. And we found that the mothers have a very high psychological burden, high levels of anxiety and depression. So we must address the issue of the caregiver burden. And this is a meta-analysis of the meditation intervention for the caregivers. And what they found was with meditation, there is a significant improvement in the quality of life of caregivers. They have decreased depression, anxiety, stress, and improved self-efficacy. And why at the beginning of my talk, I emphasize that you should do meditation, focus on breathing through the nose. Now you must have seen a lot of videos on the pranayam, that is slow, deep breathing, and sometimes you do alternate nostril breathing. So what is the impact of breathing through the nose? So this is an important concept to understand why you should do meditation, and especially focus on breathing through the nose. So there is a direct correlation between the breathing and the central nervous system. So when you do a slow breathing is defined as less than 6 breaths per minute. The nasal mucosa has a very high innervation. So with slow breathing, you are directly stimulating the nasal mucosa, which modulates the activity of the olfactory bulb. And this in turn modulates the cortical and the brainstem function. So just by slow breathing through this circuit, you can directly impact the autonomic nervous system and the brain. Now this is a very fascinating study. This is an intracranial EEG study. So you open up the bones of the scalp and the electrodes are directly placed on the surface of the brain. And on the left side, you have these action potentials when the patient is breathing through the nose. And these action potentials disappear and the patient breathes through the mouth. So this is evidence that the nasal respiration actually modulates the function of the central nervous system, and breathing through the nose can directly modulate cognition. So slow, deep breathing from the nose entails the human limbic oscillations and modulates cognitive function. And this is a very nice article published in Scientific American, where they publish that proper breathing brings better health. So if you just do slow, deep breathing, it has a direct impact by decreasing the stimulation of the sympathetic nervous system and stimulating the parasympathetic nervous system. And this has a lot of benefits for the human body. So people who cannot concentrate or cannot meditate, there are a lot of people who will tell you, sorry doc, I cannot just meditate. So a simple technique is called 365 breathing. So 3 times in the day, you decrease your breathing rate to 6 breaths per minute for 5 minutes. And with this, you can just regulate the functioning, augment your parasympathetic nervous system, decrease your sympathetic nervous system, and that has a lot of implications for positive health, and it can decrease your levels of stress. So 365 breathing, 3 times in the day, reduce your breathing rate to less than 6 breaths per minute for 5 minutes, and this has a lot of implications on your health. So bringing this all together, is meditation useful for glaucoma? Now, based on all this evidence, we conducted the first randomized controlled trial on the effect of mindfulness meditation focused on breathing on intraocular pressure. And what we found was that in the patients who were doing meditation, there was a significant reduction in the intraocular pressure. So this was a 21-day intervention, and for 60 minutes, the intraocular pressure reduced by 25% in 2/3 of the patients. So this was nearly 75% of the patients, and there was a corresponding increase in the quality of life of these patients. And you can see a massive reduction in the level of the serum cortisol, a reduction in the inflammatory markers, the interleukin-6, the tumor necrosis factor. There was also increase in the BDNF and reduction in the reactive oxygen species. And this was a microarray analysis. There was a lot of change in the systemic gene expression caused by meditation, and a lot of genes protective for retinal ganglion cell apoptosis were upregulated. And just a word about the tumor necrosis factor. It is one of the important factors which is mediating retinal ganglion cell apoptosis due to inflammation in the glial cells. And this is increased in patients of glaucoma. So with meditation, you had a significant reduction in the tumor necrosis factor. Now to summarize, meditation has a direct impact on lowering the intraocular pressure. You should understand what are the mechanisms that can lead to a dramatic decrease in intraocular pressure. I have covered the parasympathetic activation and decreased levels of endogenous cortisol that has a bearing on the intraocular pressure. But another important factor that is taken into consideration is melatonin. So with meditation, you have increased levels of plasma melatonin. And you have specific receptors known as MT3 receptors, which are responsible for regulation of the aqueous production. So there is a decrease in the aqueous production, and this is directly related to the also an increase in the tubercular outflow with a modulation of the glycosaminoglycan biosynthesis. And this is a very interesting study, treatment of oral melatonin agonist known as agomelatin. So this was given for psychiatric disorders to patients who also had glaucoma. They were already on maximum medical therapy. And what they found was that if you give a melatonin agonist, you could reduce the IOP by 30% in glaucoma patients who were already on maximum medical therapy. So this can augment the intraocular pressure reduction even when the patient is on maximum medical therapy. The second important factor is that there is a central regulation of the intraocular pressure, and with meditation you can have a direct stimulation of the hypothalamus, and studies have shown experimentally that if you stimulate the hypothalamus, especially the arcuate nucleus, you can get a reduction in intraocular pressure, and this effect is mediated by beta endorphins. And this is the study that we presented last year at RO. So this was our oral presentation. Does meditation have a direct impact on ocular tissues? So we randomized patients who were waiting for trabeculectomy. One group underwent meditation and the second group continued medical therapy. So the patients who did meditation, we operated and took the trabecular meshwork specimen, and then we did the gene expression. So what we found was that there was significant upregulation of the nitric oxide, both NOS1 and 3, in patients who were doing meditation. So upregulation of nitric oxide may be one of the major mechanisms of why meditation is leading to a reduction in intraocular pressure. You are all aware that nitric oxide can lead to a relaxation of the trabecular meshwork, and it can also increase the blood. And in fact, the main mechanism of how meditation is beneficial to the human body is that it increases levels of nitric oxide. So this is the main mechanism of how the relaxation response works and is beneficial for the heart or the eye or other parts of the human body. So to summarize, in modern research, we spend billions of dollars on glaucoma research. But we should remember that Mother Nature has put in us a precious inner pharmacy, and we should try and harness the power of the human brain for healing our diseases. And this is our article I have emailed to Augusto. You can all read this meditation as a polypill for glaucoma, published in the February issue of Journal of Glaucoma. And why this is important? Because with a single intervention of meditation, you are not only reducing the intraocular pressure, you are augmenting the blood flow to the eye and the brain. You are reversing autonomic dysfunction. You are improving mitochondrial function. You are decreasing inflammation. You can reduce glutamate excitotoxicity. You are increasing the brain-derived neurotrophic factor. You can arrest neurodegeneration, and it has a positive effect on the quality of life of a patient. And of course, you can also impact the associated systemic disease, like I showed you, patients who have got cardiovascular disorders or other ailments of the human body. So to summarize, the goal of glaucoma therapy is to reduce intraocular pressure to target, but you should also target the patient. So my take-home message is that you treat the eye as well as the patient behind the eye. And another thing I want to emphasize is that you have patients coming in who have lost hope for glaucoma. So they say, doctor, I'm losing my vision and I'm very depressed and I feel I'm going to become blind. So with meditation, you can also change the perception of the disease and have the patient this positive feeling that he's going to improve and become better. And it's important to understand this quote from Bruce Lipton, that the moment you change your perception is the moment you rewrite the chemistry of your body. So the patient has a disease, but with meditation, you change him to a positive perception so that he will take the treatment in a positive way and always have this optimistic feeling that he's likely to become better and not lose the vision due to glaucoma. So I end this talk with this famous quote from the Buddha. So somebody asked him that, what have you gained from meditation? And he replied, nothing. However, let me tell you what I lost: anger, anxiety, depression, insecurity, fear of old age, and death. So I thank you all for your kind attention, and I'm happy to take any questions. Thank you.
Well, thank you very much, Professor Dada. I think it was one of the best lecture I ever seen, and it's so important. And I think we should add for almost all of our patients. And at the end, showing the importance of meditation for the really advanced glaucoma, and even for patients that are blind for glaucoma. I think it really makes sense of the concept of treating the whole patient, not just the op nerve and the IOP. I think it was perfect. I have some questions that people sent to us, but I have my own questions. I saw there's some papers that the duration of the meditation was for 20 minutes. I remember, if I'm correctly, that in your randomized clinical trial, you used like 1 hour every day. I don't know if it's just for the proof of a concept, you have to do something strong. To say strong is something funny to say about meditations, but I mean, for a long period of time, 1 hour every day. And how do you think that would be the compliance of the treatment after the trial? If you think that gonna keep doing that, what's the minimum that you think it's enough?
So I would say you can start even with 15 minutes. So what happens that initially to do meditation is very difficult to focus the mind. So if you just start with slow breathing, that helps to increase your focus, and it has beneficial effect. Just slow breathing has beneficial effects. You can start with 15 minutes, but actual substantial benefits start occurring after half an hour.
Mm-hmm.
And currently we are peaking at 45 minutes.
Every day?
Now, yes, 45 minutes for our clinical trials. It starts with slow breathing, and gradually the patient goes into meditation, because we are in a world in which you have a lot of people have sort of attention deficit disorder. It is very difficult for them to concentrate.
Mm-hmm.
So when you sit in meditation, it requires nearly 15 minutes for you to go into a meditative state. You can't just close your eyes, go into meditation for meditation naive patients. And the second thing is, what we found was that we took patients with moderate to advanced glaucoma who are facing surgery. Surgery has got a lot of side-threatening complications. So once the patients start doing 2, 3, 4 days, they find that intraocular pressure has come down. And some patient, it falls very dramatically. So patient gets this motivation that for the first time, they are finding their intraocular pressure at a level they have not seen for years. And that really motivates them to do meditation.
I see. Mm-hmm.
And though we had a trained instructor for the trial, many patients have continued because one, they see the intraocular pressure coming down, but you will feel they feel very happy and exuberant. They are very, I mean, they had the disease before also, but now they are quite happy overall. They can cope with their disease better. They have better quality of life. So because of that, they continue meditation on their own. So, Augusto, I can't hear you.
Sorry, I blocked the microphone so I can hear you better. I'm now going to give some opportunity to our colleagues, the other panelists, to make some questions, while I'm reading the questions for the audience to make some other questions for you. Carolina, Thiago, Ricardo, Jair, Thiago, everybody that's on, please be free to make questions. Jair?
Okay. Do you hear me, Professor Dada?
Yes, please, I can hear you.
Good morning for you. First of all, I would like to say that it's an honor and a pleasure to meet you and congratulate you for the presentation. You have mentioned stress as an important cause for increasing IOP. Do you believe this stress could be primary or secondary to glaucoma itself?
So I think it's both ways. I will tell you, we have seen after studying all this, we have patients who have an emotional stress and they come with ocular hypertension. It can be a primary factor leading to increased intraocular pressure. And of course, patients who get glaucoma and visual field damage and they know it's a blinding disease, they also have increased stress levels. So it works both ways. I think it is important factor involved in the pathogenesis of glaucoma, stress as a primary factor, but also it increases once you get glaucoma and a visual field deficit causing the fear of blindness. So it works both ways.
Okay. And second, is there any study that shows that more stressed people without glaucoma have a higher IOP?
So there is some studies which have been done to put patient in a stressful situation and they have seen the response that they get a rise in intraocular pressure, but that is transient. It has not led to glaucomatous optic neuropathy.
Okay. Okay. Thank you, Professor Dada.
Thank you.
Professor Dada, thank you very much for your presentation. Congratulations on your talk. And I have read some of your papers. And I have just one question. Do you have long-term data, I mean, like regarding visual fields or any structural measurement in these patients that are undergoing meditation? I know in your trial, they did just 21 days for meditation, but do you happen to have any long-term data, I mean, like 2 years or 3 years, comparing patients with and without meditation?
So that is very good question. Actually, currently, we don't have long-term data, published data. We are doing an ongoing study, which is now going to complete 12 months. We have currently done only the short-term studies up to 6 weeks because we just wanted to prove the concept that it can lower the intraocular pressure. Our current study is focusing on the visual field issue, but I cannot comment. It's an ongoing study. And we also try to do MRI imaging. But you know what happens? I have, like, if you go under the MRI, I have done myself and try to do meditation. The current MRI we have, the background noise is so much that patients find it very difficult to do the meditation under the MRI. So we had to abort that part of the study. They are not able to comply because they are naive patients. So that is a practical difficulty that we are facing. We could not do the imaging studies on our patients.
No, I can imagine. I would never be able to meditate in an MRI device. But thank you very much for answering.
Carolina, do you have a question?
Yes, I have 2 questions. Great presentation. Congratulations. You mentioned in your papers about the increased level of melatonin. Did you, for some reason, did you link the increased level of melatonin with the pattern of sleep quality? Did you evaluate the improvement of the sleep quality in patients?
No, actually, we did just the cases versus controls for glaucoma patients. And we found that the levels were different in the cases as compared to increased melatonin in the patient doing meditation. But we did not evaluate the sleep pattern or do any sleep study on them.
Okay. And in terms of quality of life, we know that usually we have like a long-term evaluation to get the improvement of quality of life in these patients. Did you have any opportunity to measure the quality of life for a longer period or only for after 21 days as you did in your clinical trial?
So we have now measured 6 months, 9 months, 12 months. And at all time points, we found that the quality of life is improving, definitely.
Okay, great. And we have a question in the chat, and it's the same question as I have. Did you have any preference in terms of time of meditation? Because in your study, you use it during the morning. Is there any preference, like in the morning, the afternoon?
See, meditation is best done before you are involved in your daily activities, because then the mental circuitry firing goes very high. So meditation practice is best done in the morning before you are engaged in any other activity. So all these studies were done in the morning time, basically
Okay.
8 to 9 a.m.
Okay, thank you so much.
So you have to unmute yourself, Augusto.
Sorry. I invite Dr. Mura from Chile. He was with us to make some questions also. And I'd like to hear from Alexandre and Ricardo, their comments on the lectures. Alexandre, any comments?
Professor Dada, thank you very much for your talk. It was very good. Thank you very much. Alexandre Reis from São Paulo. I'd like to know from you, how do you approach the patient? As you know, meditation is not very popular in Brazil, how it is in India. So, and what would you recommend for us in this approach? I would like to know as well your results in your office, in your practice. What have you seen in terms of IOP and in terms of practice in your office? Tell us about your practice a little bit more.
So I tell you practical experience. I had this very high profile lawyer who is a friend, and he used to bring his daughter for glaucoma therapy, and he used to get his pressure checked. It was always 16, 18. And then one day he came for checkup and his intraocular pressure was coming 30, 32. And I couldn't get it, what has happened. So I just was talking to him. So he was handling a very high profile criminal litigation and it was under a lot of stress. And I found first time I could directly link the stress with the intraocular pressure. And because he was my friend, I asked him to do meditation. If anybody else, they would think I'm crazy, but he knew me for 10 years. So he started this meditation. And after 10 days, he saw me again, intraocular pressure was low. So that hit me, and that is why I started this investigation into this. Now, the second issue is how to convince patients. Patients are taking multiple eye drops, and many of them are progressing. And the next stage they will face in our country, trabeculectomy. Trabeculectomy, if you read, you give the patient the information sheet, has so many side-threatening complications. Many patients are scared of surgery. So you tell the patient that we can try meditation for some time. If it works, if you do well regularly, it may reduce your pressure and it may defer surgery. So the patient has really a risk or is afraid of surgery. So if you discuss with them, they take on meditation, and because they want to avoid surgery, many of them do it very seriously. And when they see the pressure in the next visit has come down, that really motivates them and they carry on because they realize that there is no other treatment for glaucoma. They may lose their vision. So that is something which they understand, and that is why they do meditation, because there is no other therapy available, and what we are offering is something which can lead to loss of vision.
Mm-hmm. Thank you very much.
Dr. Dada, before asking Ricardo Suzuki to make the discussion and Dr. Mura, it's a funny thing that if you compare meditation to the MIGS device, is much better than the MIGS device. The amount of reduction of the IOP is much better than put something inside the eye. It's just a joke, but it's funny to know.
So I think if you see the minimum reduction you will get, it will be 10 to 15%, and the maximum will go to 30-35%. It depends on the individual. Some people are very good meditators, and some people they cannot do. So you cannot generalize, but because these are trials controlled by a trained teacher under supervision, the results are better. But we have seen in general, minimum effect 10 to 15% you will still get, even if you are doing in a casual way.
Okay, Suzuki, do you want to make some comments?
Yes, very nice presentation, Professor Dada, and thank you for your presentation. I think that's an issue that we are not used to have here in Brazil. And I have a question. Besides of all the factors that you have shown for us that can increase with meditation, my question is about the compliance of the treatment, clinical treatment. Do you think that those people that have a non-stressful day meditation get a better compliance with a clinical treatment, or that's not an important issue that you believe that?
So we have not evaluated actually their compliance in a scientific way, but on the whole, the patient gets into this optimistic mode about their therapy, and also they have an improved relationship with you. So their relationship with the doctor improves, and they are better patients in terms of they understand you, they understand the disease, and they also have this power now that they can have a direct implication with their behavior on their disease. And I think the most important thing to understand is that we are dealing with the aging population, and they have other issues. So if you improve the brain quality of life, if you prevent neurodegeneration, overall their quality of life improves. And this is an intervention which can be done by elderly patients who cannot do physical exercise. Even bedridden patients can do this. So I think it's a wide implication, and it makes the patient a better and more compliant patient overall, and also improves your relationship with the patient on the long term.
Okay, thank you very much.
Okay, now, Dr. Mura, I did not invited you. I just put you as a panelist. Sorry about that, but I really want to hear your impression. We were discussing the chat, and I want to give you the opportunity to make some comments. Dr. Mura is a good friend from Chile, and he's excited about the idea of meditation. Dr. Mura, please, be my guest.
Thank you for your kindness. First of all, I want to congratulate Professor Dada for your lecture. I think it's the third time I see you, and I think every time it's better. You have a lot more data now than the last time I saw you in Melbourne. And I think it's very important to think out of the box time to time, you know, because always you look the patients in the same way, and sometimes you have to look outside. I think it's very important to connect with the patient in a different way. I think we have to look for different ways to improve the compliance, and I think create a stronger bond between the patient and the doctor with advices like that is going to improve our relation and going to improve also the compliance. My question is about the melatonin agonists. You talk about the 30% of reduction of the IOP, but I don't know if the doses that use the patients, because you thought it were psychiatric patients. Maybe the dose that they use is too high for a normal patient.
Yeah, no, that is a melatonin agonist. I think they have used 25 milligram of dose, but it's just a proof of concept that patients who are already on maximum medical therapy, melatonin works on a different set of receptors in the trabecular network and the ciliary body by a different mechanism as compared to the alpha or beta receptors. And this has also been shown in experimental studies in rats. You know, they were already putting them with alpha agonist or beta blockers. And when they gave in melatonin, there was an increase in the intraocular pressure when we thought already the maximum IOP reduction has occurred. So the IOP reduction went to like 60-70%, which was, this was an experimental study. So this is just a proof of concept, because this is a very small group psychiatric patient with glaucoma. But I just want to emphasize that this may be one of the mechanisms of how meditation can lower IOP, because we are finding a dramatic reduction in IOP in some patients. So how to explain? So you can see there are multiple mechanisms: nitric oxide, melatonin, cortisol, and the parasympathetic, all working together with the central intervention. And if the patient is doing well, then you can have a very dramatic reduction in intraocular pressure.
Okay, I think that for the people that don't believe that meditation could help somehow, they have to think that how the brain could damage the body. If you think the opposite, you know how the brain could damage the body, how the brain could give you central cirrhosis, how the brain could give you a heart attack, how the brain could rise your IOP, and all the things that your brain, you're not just, I mean, what I mean, the brain is when you're not a calm person, and the effect of this in your daily basis, it's huge. So if you can change somehow, it would improve a lot. And the quality of life, the end of your presentation again, showing that even if there's no result at all in the glaucoma progression, if you can improve the quality of life with the meditation, it's a huge thing. I don't know if anybody has any question. We have a lot of questions on the chat. I think we make most of them. It will be recorded, and everybody that would like to have an idea of the presentation and take the notes of all the papers that you have shown, it's in it's recorded in the presentation. Do you know if someone have any questions from the panelists? No? Well, Dr. Dada, I would like to thank you very much again. After this pandemic, I'll be very happy to invite you to Brazil to give a lecture in person, that we actually could shake the hands, and we would be proud to have you here. I think everybody would love to have you here. And as soon as the world goes back to the normal, I don't know what's normal anymore, but we'll be happy to have you here. And we invite Muda to be here so you can give you a hug and shake your hands, and everybody would love to have you here. Any more questions?
You can teach us to breathe.
Yeah. So the final words for you, Dr. Dada, and thank you again.
Yeah. So I think it was really a nice interaction with my dear friends from South America, and I really believe that meditation is something which you should explore, because it is like exercise, you know, it is something for the brain, and we are all degenerating as we age. So it is something which is for the brain. In the last decade, there has been exponential research on the benefits of meditation for the human brain, and especially related to aging. So this is an area you must read, you must investigate, you must tell your patient the benefit. And I think you must do yourself, because until you do yourself, and get convinced on your own, it is very difficult for you to convince the other party. But if they ask you, doctor, are you doing, and you say, no, I have no idea, then it becomes a different thing. So you can try on your own, and it will definitely benefit you and make you a better person and a better ophthalmologist and better husband, better wife.
Well, thank you very much again. I'm going to close the meeting now.
Thank you.
I hope to see you soon. Stay safe and see you soon. Thank you very much again. Thank you very much, all the audience and the panelists. Thank you. Thank you, Dr. Mura. See you soon. Well, I'm going to end it now. Thank you.